Hi everyone and welcome to this month's agenda. Today we've invited Dr. Jessica Taylor to join us to have a conversation around changing the narrative around victim blaming. So we're running a campaign this month called It's Not Me, It's You, and it's focusing on how we put the blame back onto perpetrators of sexual abuse. So Jessica has done a lot of research into this area. You've wrote a book called Why Women Are Blamed for Everything, and we just thought it'd be really interesting to hear your perspective on this area, Jessica. So how do you feel that we need to go about changing the narrative in relation to victim blaming? Because I know I've looked on your website, which is victim focused, that's all around challenging, changing and influencing this that is so deeply ingrained in our culture. So I'm just wondering what you feel needs to be getting done, what we can be doing, what everyone else can be doing in society.
I think there are an incredible amount of phrases, words, terminology, acronyms that we use without even thinking that actually position women as the problem, or position women who've been subjected to violence and abuse as the cause, the root, the solution even. So it's about, first and foremost, it's about being open to critical thinking and critical reflexivity, that you're open to looking at your own practice or looking at your own language. If you're a member of community and not necessarily a professional, it's about, reflecting on, have I ever said these things? Do I believe these things? Or is it just a phrase that I say? Or is it a way that I term something that I thought I was supposed to say? And that, can vary really from even saying things like women who have experienced rape or women who've experienced abuse, which I argue is incorrect, that nobody experiences rape or abuse. You're subjected to it by somebody else, by an abuser, by a perpetrator. So even those tiny little bits of language, like saying, oh, she experienced a rape when she was younger. Well, she didn't, did she? Because somebody subjected her to it on purpose, because that's a crime. And by shifting even that one word in that sentence, you put the perpetrator back in the frame that actually someone chose to do that. So, really the answer to that is that they might seem really insignificant little changes, but they're not. Language constructs and can construct our understanding of entire social issues. So when we use the wrong words or the wrong language, we can shift the blame from the perpetrator to the victim, basically.
Yeah, and I completely agree with everything you're saying there, because it's really interesting that this some of the language you use, like what you said there, people who experience rape and sexual abuse, it's really commonly used by professionals. And
I was just thinking as you were talking then, Jessica, if you look at the language that we use in our own literature, on our website, in our leaflets, we say people who have experienced abuse, don't we? And it's, as you say, just one word. The difference in that is huge, isn't it? If you change that.
I don't think it's necessarily like incorrect, you know what I mean? Because it is an experience. It's more that I want us to make an active choice to position it back as a crime, that somebody subjected them to that form of violence or oppression or fear or abuse or control. So in terms of, if you were to look at it linguistically, to say that someone experienced a rape is technically correct, but we're choosing, especially from my angle as a feminist, I'm choosing to position the perpetrator back into that crime by saying that women and girls are subjected to rape and abuse and harassment, rather than just experiencing it, which almost like deletes it. It like erases the perpetrator at all, almost like you could experience a rape on your own.
Yeah,
totally agree. And it's amazing when you point something out and you think, oh yes, and it makes absolute perfect sense, but has never occurred to me before.
I think as well, it's like, because obviously victim blaming is like an attitude which suggests you know, like the victim takes the full responsibility, and it's the perpetrator that bears responsibility for the assault. So it completely just, yeah, like makes the, you know, survivor feel maybe a bit as if they were, you know, they were meant to have this experience as well, in a way, I suppose.
I think
Yeah.
when you think about this issue of victim blaming, there are so many different levels and strands to it, aren't there? And when we look at the way that the survivor themselves view themselves, and there's always a level of responsibility. The perpetrator often will more than will often put the responsibility fully on the victim. We see that within the criminal justice system. We see it, we often hear comments when people have said to us, when women have said to us, they've gone to report and a police officer has said to them, "Are you sure you want to do this? This is a very serious allegation." Well, of course it is, and it's something that they've, I want to use that word again, they've been subjected to. So, but that's very off-putting straight away, isn't it? And then that person then feels responsible for what that perpetrator might go through by them making such a serious allegation against them. So there's just so many levels to it.
Yeah, no, I agree. The other one is victim and survivor, which relates into the discussion around experienced or subjected to, because I think that we have a tendency, especially in women's services, feminism and abuse services generally, to believe that the term survivor is better than the term victim, and that victim equals negative, survivor equals positive. And that isn't the case. When you actually, do these pieces of research and ask women themselves, do you prefer to be called a victim or a survivor? What you'll often find is that women will tell you they hate both. Yeah. And there's a bit of an assumption on our part that we say, oh no, we don't say victim, we say survivor. Well, in actual fact, why are we saying either to address women? Because why are they being defined at all by what a perpetrator did to them? So when you start just talking about women and girls as if they're victims or survivors, the entire conversation and their identity becomes defined by the fact that they were abused or raped by somebody. So when you call them a victim, a lot of women will tell you that they feel that it's negative, that it feels static, that it feels oppressive. But when you say to them, well, do you prefer a survivor? They'll say, well, no, because I don't feel like a survivor. I feel like this still impacts me every day. And I feel like being called a survivor puts pressure on me to feel like I got over it and I'm a survivor and, everything's better now, and it isn't. So, that's another one that we really should discuss, is like, why have we developed these names, these labels for women and girls who've been subjected to crime, which is what has happened. They've been subjected to male violence. Why do they then become defined by the act of a man who chose to rape them, for example? So why do they then get a label as, oh, they're survivors, they're victims, rather than women and girls who were subjected to that particular crime? And that's why I've chosen, I'm trying to sort of talk to people about that we could be making a choice not to call them survivors, not to call them victims, but actually to say, you're a woman, you have a whole life, your career, you might be a mom, a sister, a wife, a daughter, you have your own identity, talents, hobbies, skills, career, everything that you have. Why are you suddenly now you're just a survivor? But whereas if we can position her as a woman who has been subjected to an assault, we don't take away her identity of all the other things that she is, right?
And you wouldn't say survivor in any other crime, would you?
No.
You know what?
You've survived burglary or...
No. It's so interesting that you've said that, Jessica, and this is something that I personally find myself struggling with all the time. It depends on who you're speaking to. So when we're speaking to people in the centre, we refer to them as clients. Counselling clients is for clients. Then when we talk to, say, publicly, we talk about survivors, but if we talk to the police, we talk about victims. So we're constantly trying to change our language to suit our audience, but not thinking actually that that's such a good point, because lots of people are horrified to be named either, aren't they?
Yeah.
And it's so interesting. I literally just had a client only a couple of days ago where we had that very conversation about, I'm not a victim, I never want to be a victim, but I'm not comfortable being a survivor either. So
Yeah.
that's so, yeah, so interesting that you've raised that. Oh, there's
Yeah.
a lot to think about our own stuff as well, isn't there? And
Well, I think what I heard you speaking about as well, Jessica, in relation to risk assessing. You know, we feel like we're protecting people when we do risk assessments, but actually, again, what we're doing is using terms like vulnerability. You know, there's vulnerable factors here that make a person, say, vulnerable to being exploited, if we're talking about sexual exploitation. And I was listening to you speak about when we do like education work as well with people who've been subjected to sexual abuse. You know, I get why that's been developed and put into place, because we're people are wanting to educate and protect, but at the same time, actually, that could be very damaging as well, couldn't it? In terms of how that's received.
Yeah, there is an assumption basically, because I'm aware of time and stuff, but basically what you've just said comes down to an assumption that if you educate women and girls about male violence, sexual violence, domestic violence, they'll be able to protect themselves from it because it's them with the vulnerability. So what it does is it positions women and girls as the vulnerable party, and that if only they knew more and if only they could protect themselves better, these crimes wouldn't happen because men wouldn't target them. And there's no evidence to back that up whatsoever.
yeah, if you look across the whole board in terms of how, like you say, how we risk assess and how we try and keep people safe, for example, if you look at the social care proceedings, women are often, you know, we see women lose their children because they can't keep their children safe. We see children being placed with the perpetrator father because the woman's mental health has declined because of the violence that they're suffering at home. They can't keep the children safe from the perpetrator, but children are moved to them. So actually not the services and the support services, the criminal justice system is not victim focused in lots of aspects, isn't it? And I think, you know, we see that all just too often, don't we?
Yeah, absolutely.
It's such a massive subject that trying to condense it into 15 minutes is
I know, we could be here all day, couldn't we?
yeah, but I mean, even just in 15 minutes, actually, the points that you raised, Jessica, are already we're reflecting as professionals who've been in this profession for a long time, you know, that this is what you started by saying, that what we can be doing is reflective practice and kind of having a critical approach to our practice in order to move things forward. So thank you so much, Jessica, for joining us. And as I said at the start, your website is Victim Focus, and what we'll do is we'll include it in the narrative below the video. So if anybody wants to look at your website, obviously we can direct them there. So thank you so much for joining.
Thank you. Thank you
Thank
so
you,
much.
Jessica.
Thank you.
Okay, take care.
Take care.